In this section, I'll talk about antidepressant medications, which are used to treat major depression. Before I start, I want to be very clear that I'm not a medical doctor, and what I'm saying should not be considered in any way to be medical advice or treatment. It's the job of the treating physician to determine the best treatment for the patient. With that said, I want to give you an overview of the role of medication in the treatment of major depression and address some questions that frequently come up. How do medications work? Depression is a medical problem like diabetes or high blood pressure. Research has found that antidepressants are effective for treating depression and work by increasing brain chemicals that regulate mood. These brain chemicals are called neurotransmitters. Depending on which antidepressant is used, the medication will increase the neurotransmitters serotonin, norepinephrine, and/or dopamine. How long do medications take to work? All antidepressants must be taken as prescribed for 3 to 4 weeks before you can expect to see positive changes in your symptoms. So it's important that you don't stop taking your medication because you think it's not working. Give it time. And if you have concerns, discuss them with your doctor. What if my medication doesn't work? Sometimes the antidepressant you try first may not lead to improvements in symptoms. You and your doctor have a lot of choices of medications, and it's hard to know which one may work best for you. This is because each person's brain chemistry is unique, so what works well for one person may not do as well for another. Be open to trying another medication or combination of medications in order to find a good fit. Let your doctor know if your symptoms have not improved, and most importantly, do not give up searching for the right medication. Can I stop taking my medication? Once you've found a medication that works for you, it's important to continue taking the medication as prescribed. If you've only had one episode of depression, it's typical for treatment to continue for 6 to 9 months. If you've had more than one episode of depression, your doctor may recommend longer-term treatment. To prevent depression from coming back or worsening, you should not abruptly stop taking your medication, even if you are feeling better. Medication should only be stopped under your doctor's supervision, so if you want to stop taking your medication, talk to your doctor about how to correctly stop. Let's go over the antidepressants now in more detail. First, one thing to note is that prescription drugs go by 2 names, their brand name and their generic name. In the upcoming slides, we first list the brand name and then the generic name in parentheses. There are 5 different classes of antidepressant medications, which I will briefly review. The first class is the serotonin reuptake inhibitors. This group includes the selective serotonin reuptake inhibitors, or SSRIs, and the serotonin modulators. SSRIs are the most commonly prescribed antidepressants because they have relatively few side effects, and they work by increasing the level of serotonin in the brain. Serotonin modulators are newer drugs that act like SSRIs, but also affect other serotonin receptors. The second class of antidepressants are the serotonin and norepinephrine reuptake inhibitors, or SNRIs. SNRIs are similar to SSRIs in that they increase levels of serotonin in the brain, but they also increase norepinephrine to improve mood. The next class are the atypical antidepressants. In addition to targeting serotonin and/or norepinephrine, atypical antidepressants may also target dopamine. The fourth class includes the tricyclics and the tetracyclics. This is an older class of antidepressants that also work by increasing levels of serotonin and norepinephrine in the brain. These medications are good alternatives if the newer medications I went over are not effective. The last class of antidepressants are an older class called the monoamine oxidase inhibitors, or MAOIs. These medications work by blocking an enzyme that breaks down serotonin, norepinephrine, and dopamine. Although these medications can be very effective, they are not frequently used because of the need to follow a special diet to avoid potential side effects. Like all medications, the antidepressants can have side effects. The common side effects differ for each class of antidepressant, so I'm not going to go over them. But if you have any questions, please talk to your doctor or refer to the patient information leaflet that comes with your medication. Okay, that wraps up our discussion of medication treatment for major depressive disorder. Join me next time to talk about brain stimulation therapies, which are used with severely depressed people who have not responded to psychosocial therapies or medications.